there were...
Buddy.
Everybody knows the streets of Philadelphia are crawling with the living dead. Not the cinematic zombies, but real people barely surviving, dragging themselves through alleys with nowhere to turn, trapped by fentanyl, starving, and mostly ignored.
Kensington's, to me, is like being stuck in hell.
It's an open-air drug market. It can be served any drug that you can think of.
You get anything you want up here. A lot of people, they suffer out here. You're stuck. If you don't got family, you burn your bridges. And
You've seen the clips, you've scrolled past the footage, but it's not just Philly. From Erie to Harrisburg, homelessness is spiraling out of control all over Pennsylvania. And it's not just drug users or criminals as the media often paints them. It's families, veterans, kids who aged out of foster care, individuals who got sick and couldn't pay the rent.
I mean, you know, out here, housing is very hard. I did get housed once. Unfortunately, what brought me back this time was I actually had a stillborn. I was pregnant, I had a stillborn. I lost my daughter, and then a month later I lost my father. So it was like two losses like that, big.
Homelessness in Pennsylvania isn't an isolated issue. It's part of the larger homeless crisis in America that we've let worsen over the years.
Like, I know they're trying to clean it up right now, but I don't know where they expect everyone to go.
Shelters are overcrowded. Affordable housing is nearly impossible to find. And the politicians, they throw a few million at the issue and call it progress while tents pop up under every overpass. We're not here to sensationalize it. This video isn't about shock value either. It's about uncovering what's truly going on, how people end up on the streets, why they stay there, and what, if anything, is being done to help. Let's take a look at the homeless crisis in Pennsylvania today. The growing homelessness crisis in Pennsylvania. Let's face it, if you've driven through Philly recently or even passed through parts of Harrisburg or Pittsburgh, you've probably seen it. People living in tents, pushing shopping carts, holding cardboard signs at freeway exits. Homelessness in Pennsylvania isn't something hard to spot. It's right out in the open, growing worse year after year. In early 2025, federal estimates suggested around 14,000 people statewide were facing homelessness, an alarming number. This includes those in emergency shelters, transitional housing, and individuals surviving on the streets. On any given day, more than 12,000 Pennsylvanians have no reliable place to stay. That's not just a number, it's thousands of people stuck in uncertainty.
I lost my house, had my really first house, but I lost that because I wasn't making payments and my money was going to go. So, you know, it's a constant case, it's another job.
This isn't only a Philadelphia problem. It's spreading to Scranton, Allentown, Erie, and beyond. And it's not just about addiction or mental health, even though that's what people often assume first. You have veterans, single mothers, unemployed workers, young adults aging out of foster care. Many of them had stable jobs and homes just months ago. Nationwide, about 30% of homeless individuals are considered chronically homeless, meaning they've been without housing for a year or longer or have experienced recurring homelessness. More and more aren't even staying in shelters anymore. They're on the streets. That same trend is growing across Pennsylvania. And it's not just affecting individuals anymore. More families are falling through the cracks as well. Statewide shelters are seeing an increase in single mothers with children and young adults with nowhere to turn. That fits with the larger homeless crisis in America, where entire families are becoming homeless faster than systems can manage. Back in 2019, nearly 12,000 people in the state were without homes. By 2021, that number had climbed to over 13,500. Now in 2025, we're well past that, and the numbers keep rising. Nationwide, the homeless population grew by 18% in just 1 year, hitting over 770,000. You can hardly walk through Kensington and Philly without seeing thousands gathered, like it's a street-level drug market. People are openly using drugs, and it feels like the police are nowhere to be found in that area. It makes you wonder if this keeps up, folks in Pennsylvania might as well give up on the American dream because it's already coming apart. Addiction's role in Pennsylvania's homelessness epidemic. People often say homelessness is a choice, and I didn't buy it until I witnessed Kensington firsthand in September. When people think of homelessness, drug addiction usually comes to mind first. While it's unfair to assume that every homeless person struggles with addiction, it's something we can't ignore. In places like Pennsylvania, especially in areas like Philly's Kensington, addiction is closely tied to the homeless crisis. Let's break down the numbers. According to the Substance Abuse and Mental Health Services Administration, around 38% of those experiencing homelessness in the U.S. have a substance use disorder.
Fentanyl is a downer and crack's an upper, so fentanyl you're like falling asleep, and crack you're like, I don't know how to put it, like skitzing and like running around and your eyes are bulging out. And
right.
And fentanyl you get physically addicted.
In Pennsylvania, local data suggests the rate is even higher in urban areas. That means for every 10 homeless individuals, 3 or 4 are likely dealing with some form of addiction. But instead of getting the help they need, they're often pushed further away into isolation, greater danger, and deeper dependence. Here's the truth. Addiction doesn't always cause homelessness by itself. More often, people turn to drugs after losing their homes, not before. Think about it. If you were stuck outside in the cold, with no safety, no privacy, and no real rest, wouldn't you look for some way to escape too? This raises a crucial question. Why aren't treatment options more accessible? If addiction is clearly part of the problem, why don't we see more mobile detox units, long-term recovery programs, or mental health professionals reaching out to those on the streets? It's not just about telling people to stop using drugs. It's about understanding why they turn to them in the first place and creating a path forward. The good news, some programs in Pennsylvania are starting to shift their approach. Outreach teams in Philly and Pittsburgh are building trust, handing out Narcan, and offering immediate referrals for detox and rehab. So while addiction remains a tough part of the issue, it's not without hope. It's not about blaming, it's about helping people heal. And if we're truly committed to addressing the homeless in America crisis, this is the type of initiative that needs more support. 3. COVID-19's lasting impact on homelessness. Let's take a step back a few years. Before the pandemic, life was already tough for those living paycheck to paycheck. Rent was constantly rising. Shelters were overcrowded, and many people were just one crisis away from losing their homes. But when COVID-19 hit, it felt like the ground gave way beneath thousands of families in Pennsylvania and across the country. When businesses shut down, jobs vanished in an instant. No warning, no safety nets, just gone. Some received unemployment benefits or stimulus checks, but for others, especially those in cash jobs or low-wage positions, assistance never came. Without income, rent went unpaid. Eviction moratoriums provided brief relief, but once they ended, the pileup of back rent hit hard. In Pennsylvania, eviction filings skyrocketed the moment the moratoriums ended. And it wasn't just about losing homes. COVID changed how shelters operated. To prevent the spread of the virus, shelters reduced capacity, closed common areas, or completely shut down for stretches. Fewer beds meant more people on the streets. Some cities tried housing people in hotels temporarily, but these efforts were short-lived and couldn't meet the growing demand. Meanwhile, the pandemic took a significant toll on mental health. Isolation, stress, and job loss pushed people beyond their limits. For those already struggling, it only made things worse. For some who were just barely getting by, it became the breaking point. Many experienced homelessness for the first time during this period. So how did this change the larger issue of homelessness in America? COVID didn't cause homelessness, but it revealed just how fragile our systems truly are. A virus shouldn't have pushed so many into crisis, but it did. And if it happened once, what's to stop it from happening again? That's a question we must face. If we don't learn from this, we're only setting ourselves up for an even worse catastrophe next time. The pandemic served as a wake-up call. The real question is, did anyone actually hear it? Four, the housing crisis, driving homelessness in Pennsylvania. Here's something that most people already know: housing costs are simply too high. Whether you're renting or buying, the cost of securing a roof over your head in Pennsylvania keeps climbing. For those just scraping by, it doesn't take much to push them into homelessness. This housing crisis isn't merely bad luck. It's a major factor behind why more people are living on the streets. Let's break down the numbers. In Pennsylvania, the average fair market rent for a one-bedroom apartment is over $900 a month. That might seem manageable in places like New York or California, but in a state where the minimum wage is still $7.25 an hour, that rent is nearly impossible to afford without juggling 2 or 3 jobs. And that's assuming someone even has consistent work. Housing advocates argue that to afford that rent without being cost-burdened, a person would need to earn at least $18 an hour. Most people on fixed incomes, like seniors or those with disabilities, don't come close. At the same time, affordable housing options are vanishing. Older public housing units are being torn down. New developments are going up, but they're luxury apartments, not places that low-income families can afford. In cities like Philadelphia and Pittsburgh, gentrification is making things even worse. As neighborhoods improve, long-time residents are being pushed out. They don't move to better places, they simply have nowhere to go. Even in rural Pennsylvania, things aren't much better. There, the issue isn't sky-high rent, it's the lack of available homes. Some towns just don't have enough housing units, period. And when a trailer park closes or an old rental gets condemned, there's no alternative. So what happens when people can't afford to stay but have nowhere to go? They end up in shelters, tents, or cars. Once that cycle starts, it's incredibly hard to break, especially without support. This isn't just a Pennsylvania issue either. Across the country, housing costs are outpacing wages in nearly every major city, turning homelessness in America into a systemic problem, not a personal failure. Here's the question. If housing is a basic need, why does it now feel like a luxury? Without real reforms in housing policy, more affordable housing rent control, and stronger tenant protections, the crisis will only worsen. Because at the end of the day, you can't solve homelessness without providing people with homes. Five, gaps in Pennsylvania's social safety net. If someone becomes homeless in Pennsylvania, what kind of support can they actually get? It's a fair question. We'd like to believe there's a system in place to catch people when they fall: shelters, job training, mental health services. But the truth is, the safety net is full of holes. For far too many, it's not strong enough to keep them from falling through. Across the state, there are certainly organizations doing important work. In Philadelphia, groups like Project Home and Broad Street Ministry are out every day offering meals, medical care, and housing assistance. In Pittsburgh, there's the Light of Life Rescue Mission and Allegheny Link. These nonprofits, alongside local churches and volunteer organizations, are often the first and sometimes the only source of help for those in need. But here's the problem: the demand far exceeds the resources available. Shelters are often full, particularly during the colder months. Mental health services are stretched thin, and affordable housing waitlists are painfully long, sometimes taking years. Caseworkers are overloaded, and funding for addiction recovery programs is inconsistent. People dealing with trauma addiction or unemployment often don't know where to turn for help or how to get the support they need. Is the state doing nothing? Not exactly. Pennsylvania has government-funded programs like the Emergency Solutions Grant and the Home for Good initiative that help with transitional housing and eviction prevention. There's Medicaid for behavioral health, and the Department of Human Services supports outreach and housing programs across all 67 counties. Still, when you talk to people on the ground, especially those experiencing homelessness, they often say the same thing: getting help is tough, and securing long-term support is even harder. In a state where the cost of living keeps rising, such delays can mean the difference between getting back on your feet or sinking deeper into crisis. So we have to ask, how can we hope to reduce homelessness when support systems can't keep up? If we're serious about addressing the homelessness crisis in America, social services need more than just good intentions. They need real funding, better access, and a system that treats people not as statistics, but as neighbors we should be fighting for. Six, government efforts and failures in addressing homelessness. So what's the government actually doing to address homelessness in Pennsylvania? Are we just throwing money at the issue and hoping it disappears, or is there a real strategy in place? Honestly, there are some genuine efforts underway. Programs like Home for Good, a partnership between the Pennsylvania Housing Finance Agency and the Federal Home Loan Bank of Pittsburgh, are working to fill funding gaps. They help with things like rental assistance, street outreach, rapid rehousing, and eviction prevention. In 2023 alone, this program helped over 9,000 people statewide. That's a big deal. There's also the Emergency Solutions Grant, which funds shelters and services. Cities like Philadelphia and Pittsburgh use this money to create transitional housing support, mental health outreach teams, and provide hygiene kits, meals, and emergency shelter beds. Some counties are even trying housing first approaches, which focus on getting people into permanent homes before dealing with issues like employment or addiction. But here's where it gets complicated. Funding often comes in bursts. One year there's progress, the next year it stalls. Local governments are heavily reliant on federal grants, so when Washington changes its priorities, local support suffers. With inflation and rising housing costs, even programs that once worked well are now struggling to keep up. So yes, the government is making an effort, but is it enough? For now, the answer seems to be no. If we want to truly address homelessness in America, the effort needs to be consistent, long-term, and focused on results beyond just counting shelter beds. Because this isn't just about spending more, it's about spending wisely and following through. We shouldn't act like this is normal. The homelessness crisis in Pennsylvania and nationwide isn't just an unfortunate side effect of modern life. It's a man-made disaster. It's what happens when politicians prioritize campaign donors over struggling families, when cities fund luxury condos but not public housing, and when we view poverty as a personal fault instead of a systemic failure. What we see on the streets isn't just heartbreaking, it's disgraceful. It's the result of years of neglect, broken promises, and weak leadership. And the worst part, we act like it's unavoidable. Like homelessness in America is just something we have to accept. That's a lie. We're not out of solutions, we're out of will. This country finds billions for wars, tax cuts, and corporate bailouts. But when it comes to housing the poor, suddenly the budget is tight. That's not policy, it's cruelty. Until we recognize homelessness as the national emergency, it truly is nothing will change. No one should have to live in a tent because their government refuses to act. This isn't destiny, it's a failure, and it's time we called it out. Conclusion. The homelessness crisis in Pennsylvania isn't just a symptom of broken housing systems, it's a reflection of misguided priorities. We've seen the causes: addiction, unemployment, rising rent, and a shortage of mental health services. We've seen the consequences: families torn apart, veterans neglected, entire communities abandoned by those who should be protecting them. And it's not just here, it's across the country. Homelessness in America has become a national shame. We continue to try to ignore without addressing the root causes. But here's the truth, this problem can be solved. We have the resources, the knowledge, and the capacity. What we lack for now is courage. The courage to hold leaders accountable, to transform public spending, and to recognize housing as a basic human right, not a luxury. Because in a nation as rich as ours, no one should have to freeze. Not now, not ever.